going to clearly explain to the patient that we will be administering an IV bolus medication. First, we need to set up our equipment. For this skill, we will need eye protection, gloves, a pre-filled syringe, alcohol swabs, and a sharps container. Once we have all our equipment together, we need to confirm the medication order. We will be administering epinephrine 1 to 10,000 in a pre-filled syringe, 1 milligram. We need to make sure that our patient has no allergies that would prevent us from giving this medication. And after that, we need to explain to the patient that we will be administering this medication to him. From there, with both yourselves and the partner, you need to confirm the medication using the 5 medication rights. The 5 rights are right patient, right medication, right route, right dose and concentration, and the right time. After you've confirmed these, we need to put on the appropriate PPE. Once our appropriate PPE is on, we need to put together our pre-filled syringe. We'll remove the caps and then twist them together until they lock. From there, we need to choose the appropriate site and cleanse it. After cleansing the port, we're going to come back and reconfirm our medication. We're going to close off our IV line, administer the medication at the appropriate rate, immediately dispose of the syringe, open back up our IV line to a TKO rate, and monitor our patient for adverse and desired